Hi everybody, I hope that you're well this week and the mock exam went well. For this short presentation, I'm going to look at some of the family therapy approaches that can be applied in mental health practice. It's just a brief overview, so you might want to do some further reading on your own on these approaches. There are two main approaches in family therapy. What one would call the modern approach and also the postmodern approach. So in the modern approach, this is where the family therapist is seen as the expert and they have a unique understanding of the way that families function best. So in that approach, the expert offers interventions that encourage families to behave and interact in ways that tackle an assumed family dysfunction. However, the postmodern approach is where therapy is seen as a joint venture of discovery and it's a kind of collaborative approach between a family and therapist. So the optimal style of family functioning will be unique to each family and their circumstances. So the therapist's role there is to discover what their optimal level is. Now bear in mind that's quite polarised, they're very polarised actual definitions, and that actually in practice it's likely that therapists will practice somewhere between the two. So it's unlikely that somebody will say they're a modern or a postmodern family therapist and use combinations. So in terms of models of family therapy, I'm going to go over 5 models here, and again, this is where you might want to pick a model and go off and have a wee think yourself, and explore really about ones that you prefer or you're more interested in. Structural family therapy was developed by Salvador Minuchin, and it focuses on solving problems in the here and now rather than looking at the past. It's really concerned with problem solving and assisting families to problem solve. It regards normal families, inverted commas, functioning through a set of clear rules and structures, and then it would suggest that problems arise in families when this normal structure becomes unsettled. The therapist approach then is to be really active and to uncover dysfunctional family systems, and the therapist would illuminate the problems therein. And sometimes that can even involve acting out difficult situations in role play. So something that, as we know how much everybody loves role play, I'm sure you'd be keen to participate in if you had were seeing a structural family therapist. You can see that it's very much the expert position there as opposed to the collaborative position. Another model is strategic family therapy, and that was inspired by the work of Milton Erickson, who actually worked with families, parts of families, and individuals. And he was known for developing a number of techniques, some of which could be described as strategic. So, for instance, major life events such as birth and death require change within the family. Some families are more equipped than others to deal with changes. So problems that families experience were represented in one individual in the family as if they were carrying the whole family difficulty. This approach kind of sees the family as having core problems which bring them to therapy. Usually in CAMHS that would be through an identified patient, for instance, but also in adult mental health. What the therapist's task here is to disrupt the patterns of perpetuating behaviours in the family and use solutions which have previously failed. So the therapist here again is seen as an expert in this method, and they would employ 5 particular stages in this approach. So they do a detailed exploration of the difficulties with the family, all family members, a strategic plan or a formulation to address unhelpful interactions in the family, deliver these strategic interventions. In other words, they would give the family homework to go off and do, feedback regarding the outcomes of any homework, and reappraisal and continuation of revision of tasks. This was certainly a model that was used in the CAMHS service that I worked in back in the 90s. At times families found it very difficult to take on some of the homework that they were given. It might just be to, the identified patient was to go out with their sister to the shop or something like that. I mean, very, very strategic and very, very active approaches in trying to problem solve and reframe the difficulties really for the family. So next, brief solution-focused family therapy, and that is grounded in the principles of solution-focused therapy, and that was solution-focused therapy was developed by Steve DeShazer and Insoo Kim Berg. It's an interesting subject to read about, I would say, very practical approach. It's usually limited to 5 or 10 sessions, and the focus with the therapist here is what works well for the family at the moment. So it's not really problem focused, it's solution focused. And what the therapist would do would be look for exceptions to when the family were having difficulties. So they would look at when are things going well, what's happening when things are going well, how are the family communicating with each other when things are going well. So it's really to aim to enable families to solve their own problems and identify their strengths as a family. So you can see here it's a different approach in that it's collaborative and it uses the family as a resource. Number 4 is narrative family therapy, and that's based on the work of Gregory Bateson. And the important premise here is that people make sense of their lives by recounting the story of their experiences. So narrative therapists recognise that people and families are able to make sense of their experiences by evolving, developing new stories about themselves. So change is brought about by developing new stories and new narratives, or a new understanding of difficulties that families have been through. Problems are often externalised rather than being seen as belonging to the identified patient. And in this approach, the reflective team is a very important part, and that would be where the team of therapists working with the family would swap with the family, and if it was in a screening room, for instance, where we have one-way mirror, the family would go into the bit where the recording takes place, and the team would go in and have a discussion about the understanding, the development of the family, and the family would watch that. So they would get a concept of what the team was saying about their problems, their solutions, and how they are developing through therapy. So that's an interesting approach and challenging for some therapists and for families. Finally, another approach is called behavioural family therapy. And this was initially used with young people in first episode psychosis. Usually involves meeting their family for 10 to 20 sessions, for instance. And the purpose here is to provide information to the family about psychosis, help the family recognise early signs, relapse prevention, and develop effective family communication. The premise that this therapy works on is the emotional climate in the family has a real impact on the patient's recovery. So if people understand what psychosis is, they understand what signs are and can get help, they can have strategies for preventing relapse, then the temperature within the family is going to be less emotionally charged. And so that in itself enables change for the young person or young adult recovering from their first episode psychosis. In this therapy, there's a combination of psychoeducation, goal setting for each member of the family, video feedback and how they're all managing, and the active collaboration of the family in family settings. So I hope that makes sense. And if you worked in some of the crisis teams, or for instance in CAMS, the early intervention team or team supporting young people coming out of the inpatient unit, they might very well use behavioural family therapy. So just as a conclusion, it's important to know that family interventions are effective across age ranges. This isn't just about young people, it's about young adults and older people as well. Also important to remember that different approaches have different standpoints. So in terms of their belief about the role of the therapist, and good for you to consider really how that fits with mental health strategy now in Scotland. You know, what approach do you think is most in keeping with the direction of travel of mental health practice? And really, I suppose the important message for you to take forward in your career is to try and consider the family as a resource or a collaborator in the treatment of the identified patient. So try not to see people just in isolation, no matter what service that you work in. Where have they come from and where are they going? They come to you for a period of time, but they're going to be grounded with their family unit for a long time, hopefully. What we're going to do in class is maybe have a look at how you take a family history and use a genogram or family tree and how to do that, so that you can have that in your toolkit, so to speak. So again, just a speedy introduction to family therapy. I hope that you find it interesting and that perhaps you'll pick an approach, a model, and do a wee bit more reading round about that. So good luck with that and speak to you later. Bye.